Good evening. I'm Jennifer Rabb, and I have the enormous privilege of serving as the president of Hunter College. It is a special honor to welcome all of you to the first virtual Roosevelt House event of 2021. With our spring semester starting next week, I want to reiterate how proud we are of our resilient Hunter students, faculty, and staff for their commitment to teaching and learning in this challenging time and showing how on campus or online, Hunter remains the place where the American dream continues to come true. We thank you also, our Hunter friends, whose support makes our mission possible. In the new year, Roosevelt House will continue to serve as a fulcrum for civic discourse on the most crucial issues facing our campus, city, state, and country. From the onset of the lockdown, Roosevelt House has helped our community to better understand not just the challenges of the coronavirus pandemic, but the fraught social and political problems that it has exposed. Never has it been more crucial that we continue to comprehend and confront the persistent threat of COVID-19 to public health. And what better place than Roosevelt House for the latest exploration of our options and obligations? And how fitting it is that we host this evening's program, which focuses on one expert's lifelong fight against infectious disease from Roosevelt House, because it was here that future President Franklin Delano Roosevelt recovered from the polio that struck him exactly a century ago this year. From Roosevelt House, he emerged from a painful rehabilitation with enough strength to stand on leg braces and use crutches to regain mobility. Treating polio, the rampant disease that nearly ended FDR's career, helped forge the career which we have gathered to appreciate tonight, that of Dr. William Hazeltine. So it's with a nod to history and great pleasure that we welcome back to Roosevelt House, albeit virtually, one of the world's leading public health experts, groundbreaking scientist, businessman, philanthropist, and author, Dr. William Hazeltine. Known for his innovation and pioneering work on conquering some of the deadliest diseases humankind has ever faced, Bill's tireless determination over the course of his long and distinguished career has helped bring health and healing to people across the globe. Today, Bill continues his world-changing work as the president of Access Health International, ensuring that advancements in medical technology translate into real improvement for the well-being of individuals, no matter where they live. Access to quality healthcare has also been a key focus of Bill's prolific work as a writer, contributing multiple in-depth studies of health delivery systems in countries as varied as the United States, Sweden, and India. In fact, when we last had the opportunity to host Bill at Roosevelt House, it was for a memorable conversation co-presented with the Brookings Institution about his landmark study of healthcare in Singapore. Just as Bill was finishing his highly anticipated new book and autobiography, which we are excited to discuss tonight, the COVID-19 crisis struck. Not surprisingly, government leaders, media outlets, and scientists began reaching out for guidance from Bill, one of the most experienced and accomplished experts in ever infectious disease. Soon, Bill not only added to his book a detailed chapter devoted to the coronavirus, he authored guidebooks for families on how to navigate this unprecedented pandemic. So we are not only delighted, but honored to have Dr. Hazeltine with us tonight to discuss and celebrate the publication of his memoir, My Lifelong Fight Against Disease, From Polio and AIDS to COVID-19. By telling for the first time the extraordinary tale of his life and career, Bill delivers insightful lessons on what it means to devote your life to helping people through science. and by charting the evolution of his work to stem the spread of dangerous illnesses, this monumental volume promised to inspire the next generation of trailblazing scientists. Truly living up to the honor he received as one of Time Magazine's 25 most influential global business executives, Bill has spent decades working with relentless focus at the cutting edge of medical research and delivery. Among his many invaluable contributions is the help he provided in developing the first treatment for HIV/AIDS. He is also the founder of more than a dozen successful biotechnology companies that have produced several important new discoveries and medications and influenced policy at the highest levels. Bill has also educated a generation of doctors at Harvard Medical School, and now he is educating the public through his writing and his frequent appearances on cable news. Bill's life work powerfully exemplifies the Hunter motto, Mihi Cura Futuri, the care of the future is mine. Bill, I feel so lucky to call you a friend and a mentor. At Hunter, we feel a special connection to the training, research, and policy making that help to protect and strengthen the health of the public. Hunter's legacy of battling against lethal infectious sickness can be traced all the way back to 1918, when Hunter students risked personal harm to help treat those suffering from the influenza virus at the time. Today, we could not be more proud of how alumni from Hunter's top-ranked nursing school have continued that legacy, performing the courageous and crucial work of treating COVID-19 patients on the front line. To speak with Dr. Hazeltine this evening, we could not be more pleased to welcome the distinguished Dr. Margaret Hamburg. In a life of extraordinary public service at the highest levels of government, Dr. Hamburg has made a lasting difference both locally and nationally. She has served as Commissioner of the Food and Drug Administration under President Barack Obama and as Assistant Secretary for Planning and Development and Evaluation at the Department of Health and Human Services in the Clinton administration. Before that, Peggy lent her incredible talents to the city of New York, serving as Commissioner of the Department of Health and Mental Hygiene. I feel so fortunate to have served with Peggy in city government and have learned from her dedication and professionalism at the highest levels of leadership, and genuinely value her generosity as a colleague. We're so grateful to have these two remarkable health professionals, true health heroes, in conversation with us at Roosevelt House tonight. Peggy and Bill, thank you for being with us and for your public health leadership. Please join me in welcoming Dr. Margaret Hamburg and Dr. William Hazeltine.
Thank you so much. Since I'm moderating this session, Peggy Hamburg, I will jump in and really feel so privileged to have the chance to interview my friend and colleague and mentor, Dr. William Hazeltine. I also feel a connection to Roosevelt House that I can't help but mention. My mother actually, as a student at Vassar, had the privilege of having tea at Roosevelt House with Eleanor Roosevelt. Eleanor Roosevelt took a great interest in Vassar College, in large part because of their Hyde Park house upstate. And my mother was actually the first African-American to be admitted to Vassar College. And so Eleanor Roosevelt, with her great interest in helping to foster the careers and interests of both women and minorities, reached out to my mother, and that has been a lasting influence in my household. And we've long admired both of the Roosevelts, and their extraordinary work, I think, has new meaning as we grapple with the challenges of COVID. But I also want, of course, to turn to the subject at hand and the extraordinary life and work of Bill Hazeltine. And I won't go through his whole resume. You've heard a lot about him already, and I hope you will read his truly extraordinary and inspiring book. My Lifelong Fight Against Disease. And I assure you, it's full of information. You will learn from it, but you will also enjoy reading it, and you will leave it when you finish, really feeling a new sense of purpose and a new appreciation about the role that science can and must play in making the world a better place. I first met Bill now many, many decades ago, back in the 1970s when I was a student at Harvard, and he was a much respected, though somewhat intimidating teacher. We all knew he was brilliant and a great teacher and an extraordinary researcher, but he was just beginning the journey of his really unusual and impactful career, where not only did he make huge contributions to the world of science and biomedical research, but he became a leading biotech entrepreneur, a global philanthropist, and a major leader in the fight of infectious diseases. And so I think we should really start even further back in time at the very beginning. And maybe, Bill, you can talk to us a little bit about how you really discovered science, how you came to love science and to embark on a career in science.
Thank you, Peggy, and thank you for those kind words. And thanks also for the opportunity to speak at Roosevelt House. It's sort of ironic that we think of Roosevelt as this great hero, American hero, in a very deep time of trouble. His name was mentioned many times in the inauguration. And in fact, his picture holds the most prominent place in our new president's office. But he was someone afflicted with polio. And the title of my book actually begins from polio to HIV/AIDS. Why polio? Well, I can remember a time very much like the time of my grandchildren are doing right now, when an infectious disease stalked our lives and changed them in very dramatic ways. Although polio was mostly a disease of the summer, we had to stay in. We couldn't go to the movie theaters. We couldn't go to the pool. And I lived in a desert and it was burning hot. We couldn't go out with more than 2 or 3 friends at the most. It has a lot of similarities. That changed, of course, with the polio vaccine, and all of a sudden the world was different. It was a wonderful thing, and Jonas Salk became one of our heroes. And later in my life, I was very privileged to get to know Jonas pretty well. And I can tell you, if anybody's interested, he was a very unusual man. I've never met a man like Jonas Salk, I have to say. He was really an unusual character. And Peggy, you might have known him too, so you would know he's an unusual person, but he made a difference. And the one thing I tell people, I'm now writing a different version of this book for 10 to 15-year-olds. We have a title for it. Science is a superpower. Science is a superpower. Why do I say that? Well, what is superpowers they can do? They can save the world. Jonas Salk saved the world. Can you think of another person who saved the world like that? Well, maybe Franklin D. Roosevelt. But a scientist working alone can save the world. And a little bit later on, there was another great connection that I had to polio in that time. And that is, I was assigned a laboratory as my first professional job as a professor at Harvard, in what was called the Jimmy Fund. It was on the 2nd floor of the Jimmy Fund building, a brick building. And it was John Enders, the man who discovered the polio virus laboratory. And at the end of the hall was a containment hood in which he'd actually made his discoveries. And if you look on the line, which I did not long ago, for pictures of John Enders, you'll see him sitting in my office. It was really a pleasure and just an honor to have that association. So polio is both a lesson for the fact that pandemics recur, that pandemics change lives, and that can be conquered. They can be conquered personally, as FDR did, and they can be conquered as a world. And a superhero can do that. Now, the question is, how did I get involved in science? In a way, I couldn't avoid it because my dad was a scientist. And I lived on a military base where he developed weapons, and all of his friends were scientists. Now, it turned out they weren't the ones I admired when I was youngest, because My 5-year-old friends were all ace jet pilots. And that was a little jazzier than somebody who sits in a chair and doodles endlessly. But later, I came to understand science. And so I grew up in a scientific environment. But despite that, because of personal experiences, I decided that I wanted to devote my life to health, primarily because I saw my mother terribly ill over and over and over again, not with one or two, but 2, 3, and 4 different kinds of illnesses. And each one could have killed her. The most difficult one was a mental illness, which eventually did take her life at a much older age. But as a child, I can still remember that feeling of helplessness. What can you do? And this is really early on, like 4 or 5. And it just kept getting reinforced. What can you do? It's not fair. This person you love so much, who takes such great care of you, suffers this way. And so I decided to dedicate my life to health, not to science. But I love science. And when I was first year in university, I was a pre-med. I was caught by a fisherman of scientists. And that's what I hope this book is, a little bit of bait for that hook. I want to help people become scientists. And if they want to be a medical scientist, fine. If they want to be a computer scientist, fine. But science is just the greatest life. And people don't quite, I think, understand that. It's not only a life in a laboratory. It's a life full of people. It's a life full of ideas. No matter where you are on the planet, you can be thinking about these ideas. You meet wonderful people. One thing that most people don't know about scientists, if you ever want to know a restaurant anywhere in the world that's the best place to eat, ask a scientist, right? Because they go all over the world. And they may not have budgets big enough to go on a yacht, but they can go on business class that somebody's paying for, and they have enough money to eat in the best restaurants wherever they may be.
Well, I think it may be time for me to ask you another question before you go too far down that road. But it's true that, careers in science, medicine, public health are enormously gratifying. And I also grew up in a household where both my parents were physicians. I was surrounded by scientists, and it made a huge difference because I grew up seeing people love their work and seeing them, really feel they were making a difference. I do want to ask you though, because as you were talking, I was thinking about, you don't just have to be a scientist though to appreciate science and of course to benefit from science. And we're living in a world where I think it's increasingly clear that we have to use science in our day-to-day activities, just even understanding how to use our cell phones, but also we need to get better at applying science to the big problems before us and really finding solutions that work. And, there are 2 aspects to the question. One is, how do you think we can do a better job with science education and enhancing science literacy for all in this country and beyond, frankly, and the importance of that, but then also get to some of the issues that we're seeing now of the politicization of science and distrust in science. So maybe start first with the science education.
Well, first of all, Peggy, I want to say it's a great honor to be with you because you've done so much. I was looking the other day, I don't know where I saw it, but I saw a picture of a young Peggy sticking a needle into Dinkins' arm, and you looked happy. You look really happy.
His annual flu shot.
Right, but you look really great. You've been sort of destigmatizing.
Yes, exactly. And I used to do it every year with Mayor Dinkins. I served 3 years with him and then 3 years with Mayor Giuliani. And when Mayor Giuliani came in, interestingly, he declined the opportunity to be publicly vaccinated by me.
Well, yeah, well, we won't go there. But let me just say, my life in science has been one door being opened for me after another. And if I've been able to do something with my life and to make contributions, it's because at every step of the way, somebody opened the door and made it easy for me to do it. And that's what we have to do for our young generation. Sputnik went up and we were shocked. And all of a sudden, from Eisenhower and Kennedy, there was a huge emphasis on science. And all of a sudden, all the curricula were reformed. We had PSSC science, we had chem study, we had all sorts of things. when I was in the university in the first year, the head of the chemistry department had a program to fish for scientists. And he had a very attractive way of doing it. He said, if you come to, we'll pay you to spend the summer and you'll meet all our Nobel Prize winners, right? Which we did. And the next summer he paid me and I got a paper in Science magazine, as a sophomore and so he was successful. And I actually gave his eulogy as the fisherman of scientists. Then when I came to be a graduate student, they just opened the doors. There was money to do my work. And as a postdoc, there was money to support me. And as a young professor, there was a special virus cancer program. So all along the way, it was the leadership from the top down, Eisenhower and Kennedy and Johnson, and Nixon, the war on cancer, all of our presidents. It's leadership that matters. And I want to make this as a special moment in American history that has just happened. We are going to have a scientist that Peggy and I both know, who's going to be a member of our cabinet. That is elevating science to the highest position in our government, other than the president and the vice president. A cabinet member is a really important person. And there is now a scientist there, and he will serve on the National Security Council as well. So those are really big changes in the appreciation of science. And I think this administration is putting science forward. You can see it in the press conference today. That's the first thing. Then we have to make it possible and attractive. So you have to have fellowships, you have to have programs, and the kinds of things that I did to try to pay back what had been given to me is, as a professor, I was fortunate. I was one of 3,000 Harvard Medical School professors, and we didn't have to teach the 300, 400 students that were there. I loved to teach, and I taught undergraduates and I taught graduate students. And that's where Peggy and I first met each other. But I created a course, which is kind of a course that you never took, Peggy, but you could have, which was called Science and Social Issues, or Biology and Social Issues. And I did it in a very different way. And I thought my mission was to help a non-scientist understand how to parse a scientific argument with political implications. And we did it in a very special way. I got political activists to be my teaching fellows. And each undergraduate had to be a political activist on one side or the other. And it didn't matter to us which. Just they had to understand how scientific arguments are marshaled for political purpose. And that's what we are all facing every day. How do we analyze what's true, what's not true? And so we taught that course, and it went on for like 20 years, and it was taken on by another professor. It got narrowed down to Cancer and Society. But it was basically trying to do what you were saying, help people who aren't going to be scientists get enough familiarity with the concepts of science and how they're used in political dialogue so they can tell fake news when they see it.
Have you been shocked watching COVID at how certain basic things like, wearing masks has become such a divisive issue, or understanding the history of science and politics does that?
Peggy, shocked isn't the right word for it. When you study history, and one of the things I write about in the book is I don't take my direction from science itself. I don't say science is something where one question opens to another question, opens to another question, and you can dig down to the ends of the earth by just following science and having that direct you. I've always been directed by human need. What is it that humans need, and what can I do to help that need now? And to do that, I look at history, I look at culture, I look at art, I look at literature. I try to make a multidimensional world map and then see what my skills are that can help the pressing human need today. When you look at things that way, you understand how perverse humans are, okay? And if you think we've been through a bad time, take a look at what some of the people did in the huge plague of the 13th century, where they exterminated every Jew in all of Europe, okay? Every Jew in Western Europe. So 100 years later, they had to import everybody back from Russia. There were just no Jews, no banking, the whole economy crashed. Well, that's perverse, okay? And humans are capable of great perversity. It's unpleasant to see it happen under this circumstance. But the other thing you learn in times of plague is people are extremely stressed. I've identified a syndrome I called post-traumatic stress disorder, COV-2. And for society and for individuals, it's a dreadful thing that's happening. We are stressed. And when people are stressed, they look for all sorts of remedies, fanciful remedies. I have another deep view of human nature, which is we are always emotional and sometimes rational. Okay. And I think that sums up a lot of our reactions. So shocked isn't the right word, but saddened. I was saddened that it came to this, that you had to take something that was so life-saving and so simple and politicize it. It's been a tragedy, and we are living every day with that tragedy.
Well, we certainly are. And you were talking about how in times of crisis, people look for all kinds of hope, as well as people to blame. And, right now, people are really looking to the vaccine with a great deal of hope. And it's been an extraordinary undertaking to actually develop a vaccine against a previously unrecognized coronavirus, and not only to develop a vaccine, but actually now being administering it into people, just about a year after the genome of the new virus was first posted by Chinese scientists. On the one hand, it's a source of just huge optimism about the path forward and a return to some kind of new normalcy. On the other hand, many people think it is the panacea, and with the vaccine we'll be all getting on planes and going to movies, and life will return to normal. For others, the vaccine is a very dubious prospect. Can they trust it? Was it developed safely? Could it actually have been developed with some intent even to do harm to certain subpopulations? Was it done too fast? Was it politically motivated? And some of it building on past historical experiences, and some, based on the current political environment. But this is another sort of extraordinary moment where both, science, knowledge, and prowess has delivered something extraordinary, but yet how it translates into the real world experience is a process underway with lots of bumps in the road and lots of work to do to really engage people to understand and be willing to take it, and willing to also understand the limitations of what a vaccine can offer.
Well, Peggy, it's great to be talking to you, because in your background, you've dealt with all of these issues, and you've seen them, and you've struggled with them as an official with responsibility to deal with them and to improve the situation. And you've done a marvelous job with almost a hidden hand, which is a great, great skill. So you've done a tremendous amount. I hearken back to HIV/AIDS days. Okay, let's just take a look at some of the parallels. A new disease appears, and it's terrifying. It's 100% lethal if you get it, or very close to 100% lethal. And you don't even know you've had it. You can have it and not know it, and give it to your most intimate friends and contacts and not know it. It was pretty scary. And then all of a sudden, you saw entire industries die. You saw the fashion industry die. You saw the theater industry die. You saw the poets hit the deck. I mean, it was awful to see. And we lived through that. Again, science came through. Science, from the very beginning, I was part of that, a very detailed part of that. Finding the virus, understanding the virus, figuring out what it does, what you can do. We couldn't ever figure out a vaccine. I was just on the phone this afternoon with one of my former students who's become a world-class leader at understanding the outside of the virus and vaccines. And why we were talking about why you could make a vaccines for COVID, but not for HIV/AIDS. But you remember, Peggy, at the time that everybody said, you have secrets that you're keeping from us, and you're trying to kill us because you don't like it that we're Black, we're gay, we're minorities, and you're trying to kill us. And not only that, Peggy, I was accused of developing the virus myself. The Russians had their disinformation campaign, pretty familiar, which
Right.
was that Bill took Visnavirus, which I worked on, HTLV, which I worked on, and put them together and cooked up. Okay, HIV. Not credible, but credible enough that that was a sub theme, and I got a little flack for it, I'd say. But again, and then when the first drugs came along, they thought they were a panacea. They worked for a short time, and then you had to. Then unfortunately, I had friends that were recovered from death's door, only to be healthy again, only to die again. And it took us 10 years to get the right combinations of drugs. And even just last year, we have the best drug ever. One shot will protect you from getting infected and will stop you from getting ill for 8 months. One shot. So that's where we're getting, and that's what we're getting. And so science can come through. But public policy was a mess. If you think people didn't want to talk about COVID, Ronald Reagan went 5 years without saying the word AIDS. Finally, I was working with his friends in Hollywood through MFAR. We got him to say AIDS. He said it twice, I think. Okay. So this is familiar territory. Now, what does that mean for our ability to cope with disease? I think, and again, you have to look at the human realities. And you know that more than anybody, being a head of the FDA, that all sorts of pressures come into you. You have to keep your eye on the ball. What is it that we can do that's going to make a difference? Okay, now we can go into whether the vaccine is going to be the panacea or not if you want, but I think from a scientific point of view, or somebody who's in public policy trying to influence that, you have to think of what can I do that is going to make the biggest difference. And I think that current emphasis on getting people vaccinated is right. This vaccine is going to work. Now, we don't know how long it's going to work, and we don't know all the ways it's going to work, but it is amazing to work. Now, I could go into a discussion that says, did we have to rely on high science or low science? And maybe we over-relied on high science. All you needed to do is grow up the virus and kill it. And you have the Chinese vaccine, who actually got made faster than ours. Our high-tech vaccine probably will be more durable, maybe more useful for the rest of the world. And it was done using a 1950s polio methodology.
Yeah.
Right? And so that's something people don't think about. They say, oh, this high-tech stuff is fantastic. Chinese didn't use high-tech. And maybe it was the wrong thing to do. But whatever it is, we've got all these things that we'll know what's the right thing to do. So there's a lot of different ways. But the one thing I think is true is science came through big time. I just wish our politics would come through big time as well. There's one other thing I want to mention about COVID, which is, I think, the most glaring fact that we don't seem to want to absorb. And that is, you didn't need much science. You needed public health to control COVID. That's all you needed. The Chinese use public health, and they have no COVID except for that, which occasionally comes in from the outside. They had a massive epidemic in Wuhan, terrible situation. 3 months later, no COVID. Done by saying who's infected, contact tracing, and isolating, not those they knew were infected, those they knew who were exposed. And they eliminated COVID, and they are using the same techniques today. So when a new case comes in, they'll shut down a whole city. That's expensive, but not to do it, as we have learning, is even more expensive. So that, I think, from a public health, and I was a professor of school of public health as well as science, when you combine the two, you see that science isn't always a solution. There may be other solutions we shall not and should not forget that can change and save an entire 1.4 billion people. And we haven't learned from that. And the moment you or I will say, China on TV, they say, you can't believe them. And not only that, they're totalitarian. First of all, say I can believe them as much as I believe us. And second thing I say is that all they did is follow what we taught them to do at the School of Public Health, where they came for 10 years and we taught them what to do. They learned and they applied it. Why didn't we apply our own lessons? So Peggy, let me ask you a question. Why didn't we?
Well, I was thinking about, I assume many of the listeners tonight are, in New York City or from New York. And, New York City's Department of Health has long been a beacon, a gold standard for public health in the country and around the world, and one of the earliest departments of health.
Mhm.
But so underfunded for such a long time, and that's true on the national level as well. And clearly we have viewed public health as a poor stepsister of our healthcare delivery system. We, maybe because in part we've developed sophisticated medical tools for treating disease, we have come to really think that's what we should mainly focus on, mainly fund, mainly develop. But the truth is that you want to have an integrated, comprehensive approach. You want to be able to treat disease once it emerges, once it's developed. And we certainly want to continue to provide the best possible care in those domains. But public health is really about prevention. It's about addressing the factors that cause disease and can influence disease before it becomes entrenched, and to really move out into communities to make a difference. And I think we, at our own peril, have neglected the importance of that, thinking that sometimes, as you were sort of referencing earlier, that science and technology, miracle cures, will save us. But those fundamentals of public health prevention and control are essential, and they will remain essential as we deal with this SARS coronavirus too. We are not going to eliminate, I don't think, your perspective on this would be interesting, this virus in the near term. It's going to circulate. It's probably going to change also. We're going to have to live with it. It will hopefully be damped down substantially and not create the burden, the terrible burden on people health and our economy as well. But we're going to have to still think about public health in important, prominent ways as we go about our lives in the future.
Well, Peggy, you touched on the third phase of my life, which has been exactly that, which is health systems writ large. One of the things I realized as a young person is you can create these wonderful tools. I later realized you could turn those tools of science into drugs. And then I came to realize a lot of people can't benefit from the drugs in our own country and around the world because of a lot of factors, cost in this country, but simply access and structure and government policy. It's just not set up right. And when you look at these systems, you realize that neither the healthcare system nor the public health system are optimized, and they don't integrate. And I came up with a concept, which is treatment as prevention, to unite the two. And when you actually think, and I wrote in the book called World Class, describing what's happening at NYU, their major transformation was to realize you've got to bring health out to the community. They have to build outpatient clinics. So they've got 400 or 500 of them all over the city now. And that is both economically and personally beneficial to the people who are there. It's making money for them, and it's getting people the health they need. That is the perfect system to distribute public health through. That we shouldn't necessarily see these two things as over here is public health and over here is medicine. They're the same. And what people are now coming to realize, the Johnson & Johnson Foundation, amongst others, or the Robert Wood Johnson Foundation, is the whole issue of social determinants of health. Your life course is determined not by medicine. I have a friend who's the currently head of Rush, and we work closely together. He's on the board of my foundation. And he sits in Chicago at it's a great medical center. 5 or 6 blocks, every 2 blocks you go, you lose about 5 years of lifespan. And it isn't, you can't get to where he is by subway, right? And he's now beginning to work on those issues. But I think if we have a task ahead of us, working with this government, which may be open to these ideas, is exactly what you're talking about. How to get into people's head that you've got to fund it. And you saw today, more funding is going into public health. But is this a lesson we're going to learn? Is this what we're going to learn and take forward? We've forgotten other lessons so fast, right?
Yes.
Let's hope. I have a hope. Maybe it's based on a little cynical hope, but it is a hope that this will teach us something different. If you say, why did the Chinese work so fast? You say, well, they're great humanitarians. That doesn't sit so well given some of their other activities. But they're very concerned about their economy. That does make a difference. And they saw SARS crash their economy. We have seen COVID crash our economy. We now have another argument. Okay, yeah, it's good to save everybody's lives, but you got to save the economy too. That goes down pretty well in America. And I
Yeah,
think we have a chance with this argument.
chance, and we have to seize it because we have seen these cycles of crisis and complacency before. But in the words of our new president, let's hope we can build back better, right?
Exactly.
Well, I think I could talk with you much longer, but I see time is moving on, and I do want to open it up for questions and continue the dialogue. But let's go. Mac, are there questions for Dr. Hastings?
There are. This has been great. So some good questions have come in, and I'll read them to you now. The first from Aus Alashamanson is, in light of the huge number of COVID-19 related publications with many retractions, do you think the scientific community needs to update the peer review system?
Let me just first say, COVID has done wonders for science communication. We know about what's going on almost as soon as the scientists know. They write it up and you can now see it and the details, what I love. Early on, I wrote something called publication by press release. I was really pissed. They were telling me that these vaccines do this, that, and the other, and I couldn't see the data. And every other scientist was pretty upset too. So I wrote this thing saying publication by press release. Okay, and that's, or publication by CEO pronouncement.
Right.
And they turn around and put another $10 million into their pocket. Wasn't so pretty. But for science, it's been great. The fact that you can now, for most journals, including the most prestigious journals, post online before peer review. And you have to say, when you quote it, this has not been peer reviewed, because you really don't know. But I rely on that every minute of every day to get my information. And there's information that we've never had before. Now, something that people have to know about science is it makes mistakes. A good scientific paper will be correct in its methodologies and its results. And if you do the same thing, you're going to get the same result. That's a good paper. But you can have a completely different idea of what it means. Linus Pauling, a Nobel Prize winning scientist, twice Nobel Prize winner, said, "I'll believe what the data permits." You can believe a heck of a lot of things, right? And so it's ultimately self-correcting. But you have to you have to gain humility as a scientist, that your fact may be reproducible, but your observation and your conclusion never is robust to time. Let me give you something about COVID, which is my own very recent experience. I've been predicting that the whole idea of herd immunity is nonsense. Population immunity, it's nonsense. Why? Because when I look at coronaviruses, I see they come back every year. Despite the fact that people make good antibody responses. Maybe it's because the antibodies fade, but it looks just like flu, exactly like flu. So why in the world would you think you get population immunity when we've had for 60 years the same viruses coming back every year to get the same people? Now, my thought of that was immunity fades. That turned out to be partially true, but it wasn't the whole truth. It turns out that the coronaviruses change like the flu viruses change. Maybe not quite as fast, but just as importantly. So that's a good example of science. And we know that because people are publishing their data like crazy. So that's a good thing that's come out of this, not a bad thing.
But just to challenge you slightly, I agree with overall what you were saying, but with so much science being posted without peer review, and also a lot of assertions being made on cable TV and in blogs and other settings, you're a very but not everybody has the ability to look at information and really put it in context and assess it. And do you think that there is some concern that there's just such a flood of information that isn't being well curated, that there are things that are misleading, and while it will correct over time, it's very hard to keep posting the corrections to the mistakes?
Well, Peggy, are you thinking about Clorox or are you thinking about hydroxychloroquine?
Yeah.
I think you can think of either one of those two things. Or more subtly, you can think of remdesivir, which the US says we should use and the WHO says we shouldn't. So there's a gradation from Clorox, the hydroxychloroquine, to remdesivir, for example. Right now, the big debate is these Lilly and Regeneron monoclonal antibodies, when to use them. It's complicated. And we don't really, to tell you what I look at it, we don't fully understand the pathogenesis of this virus yet.
Yeah,
It's very different from anything we ever really looked at. And it's like touching an elephant. You know, some people will say it's anti-interferon antibodies. Right now, they're saying the virus may induce autoimmunity. That's a brand new concept that's just come out in the last few days. So I think you're not going to, until this thing settles down, like HIV kind of settled down after a while, we're not going to really have a clear picture.
yeah.
And I think that's just part of it being new and having such a dramatic effect on people's personal lives.
Absolutely. Well, let's go to some more questions. I know that there are a lot of people that want to hear your words and your
Try to give shorter answers.
So there is a question that picks up on what you're just saying. When do you think we'll actually return to normal? Dr. Fauci says this fall. Do you think this is realistic?
It's not realistic. This thing is going to come bouncing back in some form in the fall, and it's going to make us worried. And there are going to be variants that escape our drugs and our vaccines, just like there is with the flu. Is it going to be worse than the flu? Maybe a bit worse than the flu. I would say steady state is kind of going to be like a really bad flu year. What we have to do is cope with it in different ways. We have to say, well, who's it really going to be killing? Well, 40% of the people it killed are in nursing homes, assisted living. And so another way to tackle this, which we haven't even begun to talk about, is how we handle our elder population. They're very fragile and they're dying in massively disproportionate numbers. And so a solution may not be a vaccine as much as it is a better way to ensure the safety and care of our older population.
You mentioned the flu. Steve Greenbaum asks, do you think some form of the COVID vaccine will eventually be incorporated into our annual flu shots or given separately on an annual basis to keep pace with mutations, et cetera?
I think that goes into technical questions beyond what we can foresee at the moment. I think I can foresee a time when every year you get your flu shot. But let me tell you something new about the flu shot. It just came out. It turns out that it probably protects you maybe for 4 months. So if you want to be protected in February, don't take it in October. That's new. Not only does the virus change, but it doesn't give you protection for all that long. I didn't know that. And I don't think many people knew it. And it isn't the fact that the virus is changing, it's that the immunity isn't that robust for that long. And I can go into some more details about, we were talking just before we got on about nasal immunity and other kinds of immunity. We didn't need to go into it. But the idea you should take your flu shot in November, not in September, is something which is a take-home message. And so I think there may be repeated vaccines. I think we're going to control this. I have great confidence in our ability to put this thing back in its box. And maybe we'll have to live with it, but we live with other things.
There are a lot of COVID questions here, as you'd expect, so I'll ask one more. You say we will control it. Alec wants to know what your biggest fear regarding the COVID pandemic in the near and long future is.
My biggest fear is that people won't get the message to change their behavior. We've seen that. You know, to put it pretty crudely, we are killing ourselves. Americans are killing other Americans. And I think I'd like Peggy to address this a little bit too, because as somebody who's spent their life in public health and the FDA and trying to keep people alive, to see Americans behaving in ways that are killing our fellow citizens is chilling. And that is what I find most upsetting. And that's why I keep referring to the Chinese. You know, there was a very interesting New York Times story where they actually, I think it was an Atlantic story, the same way, where they looked deeply at 2 people in China who had COVID and how they had been squeezed and the system forced them to do X, Y, and Z. They were grateful for that. What they said is, because they did this for me, they've reduced my chance of killing my fellow Chinese. And I hope they do that to the other guy to save me. That is a sentiment you don't hear here. And that's what I'm most upset about. Peggy?
Well, it's true. And I think, one of the things as we talk about, building back better, I mean, I hope that we will eventually come out of this understanding that there is a common good and that the behaviors of people matter, that infectious disease threats are real. Some people still can't really quite believe that this exists, and that science and technology, new drugs and vaccines make a difference, but also those basic public health measures, really do matter. But the notion of really making a personal sacrifice for the health of the public, sometimes comes up against the sort of American ideals of individualism, and we have to find the right balance. And if ever there was something that I think would foster that, I would think it would be a global pandemic like the one that we're struggling with. I thought it would happen from early on, but I still have hope that this will deepen understanding and deepen commitments to action. And, I think response has been mixed, but in many ways, you have to give the American public a lot of credit for, despite all the cacophony and the mixed messages and the politicization, still doing things that they never imagined they would do, that were not fun and were, in many ways destructive to their, fiscal security and their job security and their living situation, the education of their kids. And yet, people, did try to follow the guidance, but everyone is getting fatigued and everybody is hoping for a greater degree of normalcy and some clear path forward. And I guess, that I hope that also the new administration may bring a renewed sense of commitment and public spirit to this effort, as well as the best possible science and a clear strategy. And I'm sure you have some thoughts on that too, Bill.
Mac?
Sure, I'll go to the next one. This is a more general question from Hillary Lane for either of you or both of you. What is your advice for students interested in pursuing a career in public health, especially given what's been said here about the need for medicine and public health professionals to work together?
Public health could be a wonderful career. It should be grounded in understanding of science and medicine, which it is. We have wonderful public health schools. And it's also, you'll find it is increasingly global health as well, that we are understanding we're one world. Here's a virus that came from South China somewhere, spread in China and all over the world. It took one person to do this. One person infected by that virus, and the virus was off and running. One person in a country. So, public health is also global health. Global health is local health. There's not a difference. And as we've talked earlier, it's really important to look at it from a structural point of view, as well as a professional. You can have the tools, but if you don't have the system, when people ask me what's wrong with America or other countries that are having these problems, they say, look, you need good leadership. And some countries have had good leadership and they've still suffered. You need good governance. You have to have the right structures. And you have to have a sense of social solidarity. I am my brother's keeper. All three are necessary to solve a problem like that. And you have to, as somebody going into public health, which is a wonderful profession, I suggest that you take courses in governance as well as courses in medicine and epidemiology. Peggy, you might have some.
I'll just echo, Bill's enthusiasm for careers in public health. And I think that the great thing about careers in public health is that you can practice public health in many, many different settings. And you really are able to reach across disciplines and sectors in ways that are essential to really solving important problems. You know, public health really works at the interface of science and medicine and social issues and legal issues and economic issues and political issues. And it
And
can
it's
get
such an
messy and
issues.
complicated, but that's the reality of the world, and the reality of that most of the important problems, whether in this country or around the world, that we want to address, you know, will only be solved in meaningful, enduring ways if you take that kind of multifaceted approach, and public health, you know, really enables you to address that.
And one of the things I'd like, we're drawing to a close here, but I want to get back to the book a little bit. First of all, I want you to buy the book and I want you to read it. But mostly it's designed for young people to help them understand what a life in science can be. And when you listen to Peggy and to me, we've taken two different courses coming to the same place. I've done it through understanding the fundamental nature of science, making discoveries, finding, you know, how to tackle really big diseases, translating that into finding better tools for science in business and how business interacts with science, then moving on to these issues we're talking about right now. And Peggy's come a completely different route, right? Through mostly medicine and then focusing on public health and other issues. But both careers open up tremendous possibilities for a really great life. It's a life of the mind. You know, right now I'm isolated, just like most people. I don't feel isolated. I'm not suffering. Maybe I should be, but I'm not. I am more mentally engaged with my peers around the world, trying to grapple with this big problem. And that's a gift of science. That's a gift of the background. That's a gift of your curiosity and your lifetime of experience that you can get in these professions. These are wonderful professions for young people. And I'll point something else about it. These are professions for people who can move from the economically disadvantaged or the on the border of the disadvantaged and go right to the top. There is no prejudice. There is nobody cares how you hold your fork, for example. Or, you know, they just don't care. They care about what your mind is, what you can do, what you can think. It's a totally equal. And now today, it wasn't when I started, but today it's an equal opportunity for men and for women. It's a one place where women can really move forward quickly with almost no barriers. I'm going to say no barriers, almost no barriers today in medicine and science. The majority of students in medical school today are women. The majority of postdoctoral fellows are women. That is a big step forward. And Peggy, you can see that.
Well, that is a change.
So that's a message I want to deliver. It's why I wrote the book. It's why I'm now working on one for 10 to 15 years old that I mentioned as science as a superpower. I think it could be medicine as a superpower. These are great careers for young people. And I hope this book will inspire parents and children. And the second thing I want this book to do is help destigmatize science, help people demystify it. Science is just a tool. It's a tool you can use for almost anything. It's no different from a wrench in a way. It's just a method of getting something done, but it can be used for great humanistic purpose. And I want people to understand that science isn't a remote, abstract thing. It's an integral part of our human experience, and it can be directed to solve human needs, like our need to be free of this damn disease.
Well, I thank you. And I think we have come to the end of our time. I don't know if there's time for one more question, Mac.
Well, there was one more, but I think maybe it's been answered. I'll give it to you anyway in case you have anything to add. Gabriel Miller says that if he had a teacher like you, he might have become a scientist, but in all his schooling, no one ever made it as compelling. And he asks how you would change the way science is taught. And I do think you've touched on that, but if you have anything to add.
Well, I would say I've been the beneficiary of wonderful mentors, starting with my junior high school science teacher who was interested in the local rodents and would take us out rodent hunting in the desert and watch out for the rattlesnakes, to Berkeley, where I had the greatest of all mentors, a man named George C. Pimentel. And then, I've been really lucky to have 5 Nobel Prize winners be my mentors, to take an interest in me. And that is just a privilege that, some of these were really wacky guys, Okay, but they were smart and they knew how to identify and solve problems. And so finding a mentor, find your best mentor. You know, it's not up to them to find you, it's up to you to find them. Okay, you go find your best teachers. And I think that's another lesson that people should take. So,
But
thank
I
you very
also,
much for the
just to
opportunity.
add, we have to make sure that in our schools at every level, we have teachers that are excited about science and can communicate about science, because I think that, you know, it's often at those earlier ages that you get the spark of interest, and bad teaching or teachers that are uncomfortable with the subject, and that can happen, you know, are also part of the problem. So I think we need to look at our educational system and really value education at all levels more, and really also recognize that teaching science is an investment that we can't afford not to make, I think.
Right. Okay,
Well,
well, again, thanks for everybody. It's been just a great pleasure and special pleasure to speak with you, Peggy, in this format.
Well, I think that all of the audience has benefited from your insights this evening and can see, you know, the remarkable combination of intellect and curiosity and compassion and energy and communication skills that you possess, that really has made you able to make a difference wherever you have worked and whatever you've been doing. And we're all delighted that you're continuing to commit yourself to the importance of science and harnessing that science for the benefit of all. So thank you so much, Bill, for your time tonight and for all that you're doing. And thank you to Roosevelt House for hosting us. I do urge you all to go out and get the book or order it in the age of COVID, but it is available online, and it really is worth reading.
Thank you, Peggy.
So I think with that, do I turn it back to anybody, or do we?
If you have any final thoughts, now's a good time. Other than that, I think we can sign off.
Okay, well, thank you very much. And thanks to Hunter and to Roosevelt House. Take care, everybody. Bye.
Thank you all, and be well.